Today I'm sitting with my good old friend, Haseena. How are you?
I'm well. How are you, Obi? It's
Very-
lovely to see you.
It's always a pleasure to see you, my friend. Haseena is an independent optometrist practicing in Pietermaritzburg, but we're not going to talk about that today. Haseena, my friend, over the last 3 years, you have been one of the biggest advocates for excellence in primary eye health. In actual fact, not only eye health, but health in general. Where did that love and passion start? Where you have this massive concern for where things are now versus where things are supposed to be?
It's actually a very long road. It goes back a lot more than 3 years. But to be brief, in 2009 and 2010, I worked in KZN Department of Health as an optometrist. In my capacity as an optometrist, I was a refractionist only. I worked in the absence of any equipment. I just had a ret and ophthalmoscope trial frame to work with. I was examining patients in a maternity ward with 2 beds, people in labor. I was between them testing male patients and female patients. Yes, that was the way it was.
Wow.
I worked in 2010 for 6,700 Rand a month, going up to 7,000 some odd Rand, but I did it anyway. It was the biggest game changer for me in terms of optometry. I could have felt despondent, but I didn't. I did eventually leave the system because it was not sustainable for me.
For sure.
But I used that as my springboard to try and develop things a lot better. So I started a small advocacy initiative within my district, and that failed. And then I went into private practice because I had a growing family and I needed to sustain them. In 2013, 2014, 2015, I started becoming more conscious about the number of HIV positive people presenting to my practice. So there was HIV positive people, and I call them HIV unknown people. HIV positive people, from those who came, many of them were on treatment but were not continuous. And then those that were HIV unknown were never tested. KZN has the highest known statistics for the spread of HIV. Our poverty levels are high, our unemployment levels are high, so it fits the system. Anyway, as the people started coming more and more, I started realizing that more and more of my patients, pediatric patients, were also HIV unknown.
That's scary to think about it,
Because I service the low to middle income population with a bigger focus on low income. It's called Community Eye Care Center and Community Care Optometry. So what we wanted to do was, I didn't want anyone to ever have to be in a maternity ward testing their eyes, and I didn't want any pregnant mother to have a man in the ward while she was dilated. And I said, this is it. We're calling it a day. We're going to do community eye care, and people will get the dignity of private practice, the comfort of private practice, but with the affordability of state sector.
100%.
And where we could go lower than state sector, we try to initiate that as well. People were absolutely receptive. The simple gestures of a hug when you collect your spectacles used to be the reassurance that I'm doing the right thing. And from there I realized that my patients are coming here, they have these gaping holes in their health care, and there's something that needed to be done. Then I started connecting the dots between primary care, primary eye care, primary health, and primary optometry. So it was many dots, because not all of them fit each other, but all of them speak to similar things. I went on to do my master's in HIV management, and my study in my master's looked at the capacity building opportunity for optometrists to be part of the HIV response. In my literature, there was almost nothing I could find to support what I was saying, but I put the thesis together anyway. It was just a pilot study, and it would need to be done on a bigger level to see how we can...
And you were still running your own practice?
I was running my own practice, right? So once that happened and I realized, okay, the literature is not sufficient and more needs to be done, I started becoming an HIV advocate in the context of optometry. And then I started alerting people around me to say, guys, in your practices, can you speak about these things? When you see your patients, let's speak about diabetes, let's speak about hypertension, let's speak about all of this. And then a few of us started latching onto this concept because we all knew that we have the capacity to deliver more than refraction.
100%.
We have the capacity to do more than just low vision. And we started using that platform. And the turnout and the response from our patients was starting to grow. They were growing in trust. They were growing in confidence. in the fact that I can go to my optometrist and she can help me find what I'm looking for in terms of broader care. Then we started looking at why people don't refer to us. Okay, so then there was the GP overlap in terms of managing eye conditions, which we were trained to do. So I started looking at the quality of the curriculum, and I started looking at what is it that we are supposed to be doing in the context of optometry. Are we supposed to do refractions? Are we supposed to be in a primary care role, which would mean we must treat some level of diseases, but be part of the prevention program? HIV prevention, diabetes, hypertension, all of that, and then your linkage to care pathway. So if we were the linkage to care for general health conditions, why was nobody seeing us as a link for eye care? And we started trying to build that platform. And it was unsuccessful because everyone within the medical hierarchy felt that we are allied health, but we are technicians. And technicians for vision. So that was a stumbling block and that was a challenge. Then we tried to look at the district system and we needed to look at why 8 years later there was still no equipment, there was still, they've been given allocated spaces but nothing major has improved. Why optometrists were still refractionists, and again we realized...
And this is 2015?
This is 2015, 2016, 2017, even as we sit in 2018.
That challenge is still there?
It's still there. We are recognized for refraction and low vision services.
This is crazy. Okay.
That's crazy.
Haseena, what you're sharing with us now, it's very scary when you think about it. That if it's happening in KZN, do you perhaps know the stats in the rest of the provinces?
The stats
or are they more or
less
less similar?
They're similar in terms of what we recognize for. But if you look at places like Limpopo, they were the leaders in terms of having optometrists recognized for the role that they can play at a primary health level. So in different provinces it would differ, but I'm most knowledgeable about KZN because that's the area I operate in. And that's what gave birth to the Know Your Optometrist campaign.
Please tell us more about it.
So when we started with Know Your Optometrist, it was myself, an optometrist in Pretoria, Hamida Abdullah, and a few others, and we decided that we're failing at all the different levels in terms of getting people to recognize us for what it's worth. 100%. So the easiest way would be to go back to the communities that we operate in and educate them on what we are able to do. And when we create that trust and dependence from them on us, then we can take that as a motivating factor and say, this is where we should be. But in all of that time, therapeutics happened. And that was a big win. People are still struggling here and there to be able to iron out the fine print. But in the bigger picture of things, that's where we want to be. That's what we want to do. We want to be out in communities. We want to be able to extend our care where eye care services can't go.
How is it going so far? And how can companies like Visionstryt play a role in increasing the impact that you guys are having in the industry at the moment?
So every bit of advocacy that we have in this area, so where we educate optometrists, where we educate the public, where we educate everyone in general, but especially our people in the medical industry, and we capacitate them with the knowledge that we are able to do more, and we can strengthen their team beyond refraction. That's where we need to be. But more than anything else, we need to break this historical barrier which firmly places optometry in the private sector and in the retail sector. Our income is based on retail, but our output is far bigger than the selling of frames and contact lenses.
I totally agree with you.
And if we're looking at the health of our population, and 80% of what we do depends on what we can see, rural South Africa needs us. If we're going to champion change, and a healthy nation is a thriving nation. So optometrists need to move to rural.
So you're saying then, what Africa needs, what South Africa needs, we need to step out of our comfort zones as the healthcare industry and say, you know what, for Africa to get to where it needs to be, I cannot continue doing things the way I've always been doing them. And so I completely agree with you that we need to actually, over the next year, have a serious campaign on top of the one that you're having in making sure that every single South African gets the level of care when it comes to eye care that they need to have.
And primary health.
And primary health.
Eye care and primary health, because if we look to the future and we look at the way Africa is growing and we look at the population statistics of our country, province by province, we can see that there's so many more children being born. But what are they being born into? They're being born into poverty. They're being born into orphaned lives where early into their life they lose one or both parents.
Okay.
And if we want to be champions for them and we want to champion change, we need to strengthen their education and we need to strengthen their health. And without good sight, you're lacking both ways.
Right.
And that's where we need to be.
I hear you, Haseena, and we'll continue more on this engagement in the next few weeks and the next few months. I get it now.
Yes.
I'm
glad.
I get it now. Speaking to you one-on-one is different from communicating on email.
Yes.
Because a lot of communication is missed
Yeah.
in that process. But I believe that there would be a significant role that Visionstryt will be able to play, especially from an awareness point of view.
Correct.
Because we're very big on social media, we're very big on disruptive technology, different ways in which we are able to distribute and disseminate information to the rest of the population within the context of optometry. And so we'll continue this discussion in the next few weeks.
I'm looking forward to that.
Let's see what the future holds as we take optometry as a whole to the next level of excellent primary eye care and management, basically.
That's good. I started my practice, I graduated in 2007. I started my private practice in 2008 because I couldn't find employment.
Okay.
And I couldn't get into a state sector place. I ended up in El Dorado Park in a small little practice
Very
in a medical
interesting, yeah.
center. And it took me the greater part of 7 years after that to learn to be business savvy, to identify my skill as a business person, and to identify myself as a team leader.
Wow.
And this book is very, very important. And I think it's one of the better gifts you can give to someone
Wow.
as an optometrist if you need to give a gift. And it's not to promote the book, but it's to promote the principles.
Wow.
And we must all stand for the same things and things that have value. And just quickly, page 44 and 45 says, develop the people into environmental change agents, and vision should be what leads the people. Those two are very powerful.
Wow, wow.
And if we want to champion change in eye care, then that should be what leads us. It will lead us in a business space where we become sustainable and profitable, but it will lead our vision to be change agents and champions of change in the eye world.
I did not expect that.
Yeah.
So thank
Do
you very
you know
much.
your optometrist?
I know now my optometrist
You know
now.
it.
Thank
All
you
right.
very much.
Thank
We
you.
look forward to working with you in the near future.
No problem.
And we're excited about the work that you're doing.
Thank
and
you.
it will be an absolute honor and a pleasure for Visionstryt to be part of that.
Thank you. I look forward to it.